Hello guys, it's Unit 3 Part O.
Now, contraction stress test, and this examination is performed around 34th week till the delivery. That is, at the end of the pregnancy, this examination is performed and it is performed around 34th week. From the 34th week, this examination is performed. And this examination is performed to see whether the baby is able to handle the delivery process. At the end of the delivery, there will be sudden decrease in oxygen level. That is, there will be a sudden decrease in fetal heart rate. You have been heard that deceleration, that is temporary decrease in FHR. It is because of this condition. That is, at the process of delivery, when the baby is moving towards the birth canal, due to contraction there will be a decreased amount of oxygen supply. When the oxygen supply is decreased, then suddenly the fetal heart rate will also be decreased. This is because of uterine contraction. At this condition, will the baby be able to handle the situation or not, we will see here. And while taking this examination also, the mother will be tilted, laterally tilted, not in supine position. And this examination is performed for 20 to 30 minutes. And in this examination, we will see more than 3 contractions. Just 2 is not enough. We will see more than 3. And each contraction should last more than 40 seconds. If the baby is not moving when the mother is placed in the position, when the mother is ready for the examination and the baby is not moving or the baby is not responding, we will provide some kind of medicines and stimulations to make the baby move. That is, there are 2 types that are provided. To make the baby move, we will provide oxytocin challenge test. That is nothing but we will administrate the oxytocin in the dilution formula in the IV and then wait for 10 minutes and then automatically the response will be seen. Or else we will apply nipple stimulation. Nipple stimulation is applied and by that we can see there is a release of oxytocin which will promote the movement of the baby. And then why this contraction test is performed? This is performed to see whether the baby is staying healthy even at the situation when there is a sudden reduce in oxygen level. During the time of contraction, that is during the time of labor, if there is a sudden, during the time of labor, there will be a contraction. At that time, there is a chance of reducing the oxygen level. When the oxygen level is reduced, there will be a sudden fetus heart rate reduced. Will that baby be able to handle it or not? We will see here. And next, is the placenta is healthy or not? Is the placenta is supplying enough amount of blood or not? That also we will see here. In this test, we will see this both thing. Contraindication of CST. Contraindication of CST is nothing but the women who are not allowed to undergo CST. That is the woman who is having placenta previa. That is a medical condition that is seen in placenta. If a woman has placenta previa, she is not allowed to undergo CST. And the woman is having antepartum hemorrhage. That is nothing but bleeding at the time of pregnancy. Even if she is bleeding, she is not allowed to undergo this examination. And if the woman has undergone C-section, that is the previous delivery was not normal delivery, it was a C-section, that is it is a cesarean section, then she is not allowed to undergo CST. And if the woman has a chance of preterm baby in the sense the baby is born in the middle term, that is the baby is born at 7 month or 7.5 month, that is known as preterm. The baby is not born at 9 months, the baby is born at 7 or 7.5 month, that is preterm baby. If there is a chance of preterm labor, then the woman is not advised to undergo CST. Basic terms of CST. First, normal CST. This is nothing but when we get the report after the examination of CST, if we get negative, it is normal CST. When there is a decrease in oxygen level, even though there is a decrease in oxygen level, if the heart rate is not reduced, then the report will be negative. But in some conditions, after the pain, after the contraction, the fetal heart rate will get reduced. That is also normal. Next, abnormal CST. Abnormal CST will be positive. That is, when there is an oxygen level decreased is observed, the fetal heart rate will also be decreased. This indicates in further at the time of delivery there will be a problem. Next, hyperstimulation. Hyperstimulation, that is nothing but the contraction, the pain in the uterus that we seen, it should be around 40 seconds. But here we see is it's above 40 seconds, that is 90 seconds or more than that. That is hyperstimulation. Suspicious. Suspicious is nothing but first we see the late deceleration, that is after the end of the pain, after the contraction, we see the fetal heart rate will get reduced, but it is seen only once. And next the repeating pain will never cause the decrease of fetal heart rate. Next, unsatisfactory. That is nothing but while recording in the CST examination, the sound which we hear is not in a quality. That is, the sound or the beat is very low. That is nothing but unsatisfactory. These are the basic terms of CST. Questions will be provided at the end of the chapter. Until then, stay tuned. Meet you in the next video.